One of the things that we know, we often hear that medical professionals are often taught in their clinical training is that when you hear hooves, you should look for horses, not zebras. And that's one of the reasons why the zebra is sort of the mascot of the rare disease community, because patients who have rare diseases sort of identify with being a zebra. I think what both of these studies are showing, though, is that zebras are actually pretty common. And that when you're talking about more than 30 million Americans, if you're a primary care provider, you are going to many times in your career run across somebody with a rare disease. It is not going to be a super rare occurrence. And so when you see a patient who has had a couple ER visits or is in the ICU or has a genetic anomaly or a developmental disability, you probably should think about the zebra and not hesitate to worry about those hoof sounds, and that there are a lot of very inexpensive diagnostic technologies available to providers today as tools in that superhero tool belt that we encourage providers to use. And there are a lot of wonderful professional societies that have tools and resources for providers who are really working to serve their patients. So that would be the first thing that I would say. And then the second thing I would say is that I know providers work so hard. I mean, if we've learned nothing through the pandemic, is that providers really are superheroes when we talk about the superhero tool belt. But the rare disease patients are your best partner, because they become experts in their care and are the best ones to really help you understand what's happening. And really, we encourage providers to take the time to listen and understand what the various different symptoms are to help you understand how to piece together that diagnostic roadmap to get to a better diagnosis faster, and maybe not just treat the most recent symptom that a patient's presenting with. And that's the other thing that I think this most recent study shows us, is that when we look at what all of these direct costs were, many of times they were you were treating the symptom that the patient presented with at that moment. But if we had pieced together the whole picture, we probably could have gotten to an answer much faster. And so really a call to providers to sort of use those tools in your superhero tool belt. When you hear hooves, think of zebras. We have 30 million Americans living with rare diseases, and that it's the providers that really lean in, listen, and take the time to look at the whole picture that are really helping us get to the end of this diagnostic odyssey and optimize care the fastest.